And now to the growing nationwide threat of respiratory viruses and the CDC issuing a warning. 35 states now reporting high levels. Medical correspondent Dr. Darien Sutton is here to break this down for us because you are, as we said, an ER physician. So tell us what you are seeing and hearing and why this season is so concerning.
Yeah, I've been in the emergency room for the past couple of weeks up until this weekend, and I've been seeing these rising rates rise in real time. I'm testing for multiple diseases, COVID, flu, RSV, and I have to say that the majority of the test results that I'm getting back from my patients are influenza A, and that's reflected in what we're seeing across the nation. If you can look at these numbers, an estimated 5.3 million cases of flu so far, 63,000 hospitalizations, and almost 3,000 deaths. Now, this is not nearly as high as we've seen in terms of the total of last year, and we haven't seen yet the peak, but we're not sure yet exactly when that peak will be, but what we are clear about is that we need to be proactive in preventing.
What kind of a strain is this putting on the hospitals now?
Incredible strain, George. When we talk about flu, COVID, RSV, norovirus, we're talking about those infections as well as other common emergencies, heart attacks, strokes, car accidents. And so this puts a strain in terms of the ability to treat all of these patients and also space. And it becomes incredibly difficult each and every day as we march toward that peak.
Every parent knows the strain of this as well.
Yeah.
Some of the latest deaths, tragically, 2 children in Chicago recently died of the flu. What more can families be doing to protect themselves?
We always hope that those numbers remain low. And when we talk about prevention, we focus on the most effective forms, talking about vaccinations. In past years, 80% of children who died from the flu were unvaccinated. So it's an important reminder, if you haven't done so already, it's still okay to get vaccinated. Typically, the flu season extends into May, and so now it's still an okay time. If not today, then tomorrow. And then basic mitigation methods, wearing a mask, washing our hands, and cleaning high-touch surfaces is so important this time of year.
And can you tell us the symptoms and treatment when it comes to the norovirus?
Yeah, norovirus is that virus that causes nausea,
Right.
vomiting, and diarrhea. Patients often come in with the inability to hold in food, and we're treating them supportively while also managing their other chronic diseases. In terms of prevention, this is something I advise all patients and families. When you get home, it's so important to continue to clean with some part bleach, especially those high-touch surfaces. And remember that norovirus is resistant against hand sanitizer, so it's so important to make sure that we're continuing to wash our hands with soap and water during this time of year.
I've never heard that before. Norovirus resistant to hand sanitizer?
Yeah, it's a tough bug, and it's one of the reasons why we've seen close to 91 outbreaks this year, 30 more outbreaks than we saw this time last year. It's completely resistant against hand sanitizer, so that's why soap and water is so important.
Very, very important stuff. We're spraying down all the handles in our house right now, and the lights and everything too. Thank you, Dr. Darien, as always.